Hello nurses, welcome back to Edurayte Nursing Review classes. Today's question of the day focuses on delegation in nursing. Let's dive in. Here's a case scenario. A registered nurse is managing a busy medical surgical unit. The RN needs to delegate tasks to the team, which includes another RN, a licensed practical nurse, and a nursing assistant like PSW or healthcare aides. Which of the following tasks should the RN delegate to the LPN? Option A. Assessing a new patient who has just been admitted with chest pain. Option B. Teaching a client with diabetes about insulin administration. C. Monitoring a patient who returned from the operating room 1 hour ago. Or option D. Changing a dressing on a wound that has a drain. The correct answer is option D. Changing a dressing on a wound with the drain. Why? Because this task fits perfectly within an LPN scope. It does not require the advanced assessment skills or critical decision making that an RN provides. LPNs are skilled in wound care and can manage dressing and drains efficiently. This allows the RN to focus on more complex tasks, ensuring that every patient receives the best care possible. Why not others? Let's discuss. Assessing a new patient with chest pain, option A, requires advanced assessment skills and critical thinking to interpret findings, which are within the scope of practice of an RN, especially when the patient's condition could be unstable. This task involves initial assessment and potentially complex decision making, which are responsibilities of the RN. Now, option B, teaching a patient with diabetes about insulin administration, which involves patient education and understanding of complex concepts like insulin management, which is typically the responsibility of an RN due to the need for comprehensive knowledge and the ability to assess patient understanding and readiness to learn. Right? Now, option C, monitoring a patient who returned from the operating room 1 hour ago. This requires critical assessment and monitoring skills to detect subtle changes in the patient's condition, which is most appropriate for an RN, especially in the immediate post-operative period when the patient may be at higher risk for complications. Understanding delegation is key to passing the NCLEX and thriving in nursing. For more insights and tips, subscribe to Edurayte Nursing Review classes. Thanks for watching.